Excellent. So before anyone leaves, it's time for some closing remarks. I'd like to thank everybody for coming today. I feel like this has been an incredible day of informative, in-depth sessions, a variety of speakers and folks that are really helping us think about how do we move from planning to action, and how do we achieve our shared goals of achieving better health outcomes through person-centered and affordable care. I'm hoping that all of you learned as much as I did about how different folks at national and local levels are seizing opportunities and testing innovative ideas for addressing the challenges in our current environment. It's through exactly this type of exchange of ideas about strategies, practices, lessons learned that we can amplify success and support each other and the journey to accountable care. I'd like to highlight some takeaways from the summit. First, this morning we were joined by John Blum, who shared stories about real-life challenges people and clinicians are facing in healthcare, and about how value-based care can help address those challenges. Next, we heard from others in CMS leadership about the importance of breaking down silos and focusing on the beneficiary experience, and about the challenge of defining and promoting the understanding of value-based care. We had a set of panelists that discussed the keys to successful multi-payer alignment, which include having a strong neutral convener and involving multi-stakeholder perspectives. And quality measure might be a place to start some of that. We also heard about the critical elements needed for effective partnership between healthcare entities and community-based organizations. Panelists shared then and shared at the end of this session that it's vital to think about how we rebalance resources towards the community and community partners, and to advance health equity and alternative payment models. To achieve this, partners have to invest in health-related social needs, invest in capacity building and infrastructure. And it's the responsibility of all healthcare partners to create an ecosystem that elevates the community voice. This afternoon, we discussed the challenges of implementing value-based and accountable care models. Panelists discussed the balance between standardization and flexibility of value-based incentives, and the challenge of using legacy claim systems that are still stuck in a fee-for-service system. The CMS Innovation Center leadership led a question and answer session. We talked a lot about quality and specialist engagement there. And then in reviewing the evaluation of CMMI models to date, CMS has found that consistent provision of team-based care using data to enable provider flexibility and the spread of best practices beyond only the targeted model group are some key things in terms of what value-based payment is enabling on the ground. I enjoyed this session to learn about opportunities to invest in things, and the health system that found testing models of care and innovation found that 90% of their innovations didn't work, but that was helpful to them because they could stop doing ineffective things. Next, the session on person perspective. Panelists discussed that framing is key to engaging individuals in building trust to ensure more holistic care. And I think trust was a key part of our overall day themes, but especially trust at the individual level, that we need to engage folks in being part of the conversation so we can understand what is important to patients and caregivers. And finally, we heard some good news from the APM measurement survey. There's steady growth in APMs from across the U.S. healthcare industry, and payers across all lines of business are increasing investment in value-based models. Over 93 million people in the U.S. are in an accountable care arrangement where they conceive higher quality, person-centered care. So I'd like to thank participants, the speakers, panelists, and moderators for taking the time to share their experiences, knowledge, and innovative ideas. I'd like to thank all of you who have joined us in person and virtually. The enthusiasm and the conversations in the hallway was very exciting, and I think can inspire all of us to continue engaging in the LAN's ongoing efforts as we go into 2024. And then finally, I'd like to thank the chairs, members, and participants of the LAN strategic initiatives, the executive forum, and measurement efforts. And I'm eager to welcome the members of our newest projects, the National Health Plan Work Group and the Person Perspectives Council, as the LAN expands its potential for impact. There's a lot to digest from all the panels today and not a lot of break in between. And so recordings from all the sessions will be available on the LAN website so you can catch up on anything you missed. Also, stay tuned for more opportunities for engagement with the LAN from both our ongoing and new strategic initiatives. I liked the point that if delivery system reform was easy, we'd be done by now. And so I'd like to thank you all for joining us. I encourage you each to identify at least one thing you are going to do different to help us improve and change care. It's about action, and it's time to move. Thank you most of all for your commitment to improving healthcare for all, and together we can change the healthcare system. Thank you.